Good morning, friends. Welcome back to my YouTube channel Medical Classes by Dr. Srinidhi Kumar Acharya. Please don't forget to subscribe my channel and also please give your valuable comments. And you can also visit my playlist. In the playlist, I have provided all the topics so far discussed in a very systematic order. Please do visit it and also subscribe my channel. Friends, in the last class we were discussing about cerebral palsy. And we have seen some of the basics of cerebral palsy. Now, 70% of the cases are basically because of spastic cerebral palsy. Okay, spastic type of cerebral palsy. So in the spasticity, the basic problem is always contraction of the muscle. Now we should know, before planning the Ayurvedic treatment, we should know why there is spasticity. And damage to the motor cortex is there, especially frontal cortex is there, and how it is leading actually to the spasticity. So we should know this. To understand this concept, first we have to understand the normal brain physiology, neuronal physiology. Now, we know that the brain, the functional and structural aspects of the brain is called as neurons, and that is a basic integral part of the brain. Now, these neurons contain so many neurotransmitters, and accordingly the neurons will go into act. That means which action actually the neurons will do, it depends upon the neurotransmitter which is present in the end portion of the neurons, axon of the neurons. Now, when we see that, totally in the brain there are actually two types of neurotransmitters. One set of neurotransmitters are called as excitatory in nature, and another set of neurotransmitters are called as inhibitory in nature. Okay, some are related to the activation of the function. Okay, so they are proactive. That means they will perform the action. They are responsible for performance of the social, motor or sensory functions. What are these neurotransmitters? Glutamate is there, epinephrine, norepinephrine, dopamine. Okay, so dopamine 1. So these are some of the excitatory neurotransmitters. Similarly, there is some inhibitory neurotransmitters. What is the function of these inhibitory neurotransmitters? Inhibitory neurotransmitters are not actually for the initiation of the function. So they are actually for the inhibition of the function. Suppose if I am moving the limb, at one extent I have to stop the movement. Now who will get that when I have to stop? So that is because of the inhibitory set of neurotransmitter. That what I mean to say is, when any action is initiated, definitely the excitatory neurotransmitters are stimulated. In the meantime, some of the inhibitory neurotransmitters which is present surrounding it is also stimulated to control the excess movement of this particular action. And this is called as inhibitory neurotransmitters. Inhibitory neurotransmitters. And what are the common inhibitory neurotransmitters? So they are GABA, gamma aminobutyric acid, then serotonin, and some type of dopamine 2, etc. So they are basically inhibitory in nature. So some of the neurotransmitters are excitatory in nature and some of the neurotransmitters are inhibitory in nature. So any motor activity when it is initiated, so first with the sensory cortex and then to the basal ganglia and then to the cerebellum. So this is how from the any activity when it is stimulated or mediated, so it is formulated in the motor cortex and then it is come to the midbrain, basal ganglia, then midbrain, then cerebellum and to the spinal cords, etc. So always it is excitatory which initiate the muscle function, whereas inhibitory GABA is a inhibition of the muscle action. Now suppose you understand the fact that if the GABA is reduced, that means inhibitory neurotransmitters is not up to the mark. Excitatory neurotransmitters are up to the mark and they are doing their function, whereas inhibitory neurotransmitters are not up to the mark. As it happens in case of cerebral atrophy or any other decreased neuronal intake of GABA, any other conditions which leads to decreased intake of GABA by the neurons. So then what happens? Naturally, the levels of the inhibitory neurotransmitters will go down and levels of the excitatory neurotransmitters are normal or maybe excess. So now there is relative increase of excitatory neurotransmitters compared to the inhibitory neurotransmitters. So what happens? Suppose if I start a muscle action, for example, contraction of one particular muscle, now at one point of time, inhibitory neurotransmitters should start firing and they should stop this function. But in case of spastic cerebral palsy, because of the lack of the GABA, what happens is contraction is initiated, but its inhibition is not happening because there is less amount of the GABA, or there is no GABA neurotransmitters. So this leads to the persistent motor activity and constriction of the muscles, which end up in hypertonicity or spasticity. So this is a basic problem which leads to spasticity in cerebral palsy. There is no such neurotransmitters, or there is lack of neurotransmitters or decreased neurotransmitters in the brain, which actually inhibit this function. So the initiation of the function which is initiated, that will be persistent. Muscle contraction has to be, muscle should undergo relaxation now. For the relaxation we want GABA inhibitors, but there is no GABA inhibitors in excess or in normal amount. So that leads to persistence of the contraction. When the same is continued, it leads to the spasticity. And when it is not even cured, or relaxation is not taking place for many time, many hours, many days, then it leads to contractures. Then also it is not reduced, then it leads to deformities. So this is how this goes on. Now when I talk about this particular hypertonicity, okay, because hypertonicity or spasticity, contracture, deformities, these are the major problems in cerebral palsy. Okay, so now we will only target only this particular point, how to correct it. So when I talk about hypertonicity in Ayurveda, possibilities of hypertonicity as per Ayurveda is, number one, it may be because of hypertonicity due to Vata Vriddhi. I can say it is increased Vata. Okay. I can say it is hypertonicity due to Avarana of the Vata, some of the Vata Avaranas. Hypertonicity which develops because of some of the Marmahabhigatas may be possible. Hypertonicity due to Vata Prakopa, Samsa, Vyasa Bhanga, etc. They call it Samsa Vyasa Sangha. Then hypertonicity may be due to Kapha Kshaya, cerebral atrophy like condition, Kapha Kshaya, which leads to Vata Vriddhi and hypertonicity. That is Vata Vriddhi, Kapha Kshaya like conditions. So these are some of the possibilities that I can imagine when I look into this particular problem in terms of Ayurveda. Now the brain motor activity is maintained by two mechanisms, as I told earlier. One is excitatory neurotransmitter and another one is inhibitory neurotransmitter. Now as we know that excitatory neurotransmitters are dopamine, epinephrine, norepinephrine, etc. And this is responsible for the normal motor activities, and this can be compared with the Vata. Okay, because this initiates the motor activity. Va gati gandanayo. Gati means movement. So these movements, it can be compared with the Vata. Now, same can be interpreted as Raja also. When I talk about the brain, in the brain we have got three important doshas and two important gunas. One important guna. The three important doshas are Raja, Sattva, Rajatama, whereas guna is Sattva. Sattva is not considered as dosha. So, initiation of any motor activity inside the brain is taking place by means of Vata. The same Vata is represented as Raja when I talk about brain. So it is also told that Rajaha Pravartakaha. Therefore Vata or Raja, counterpart of Raja, is responsible for initiation of the motor functions. That much is clear. Because Rajam Tesham Pravartaka. Another mechanism is, there are some neuroinhibitory transmitters are there like GABA, etc., serotonin, etc. What is their function is, they control the movements. They control the movement so that it should not be in excess. A motor function is initiated, but it has to be stopped at one point, and this stoppage will be done by these particular neuroinhibitors when they are start firing. So basically, the inhibitory neurotransmitters are for the controlling purpose, so that the movement should not be in excess. So controlling stiratva, controlling Dridhatva, all these functions are the functions of the kapha, and when I talk in terms of the brain, the same is referred to the tama, because tama is niyamaka. Tama is niyamaka. So now the things are very clear now. By understanding this homeostasis of the brain mechanism, I have got one factor which is responsible for initiation of the function, that is either Vata or its counterpart Raja. There is one factor which is responsible for the controlling of the brain activity, that is either Kapha or its counterpart Tama. Now, it is also known that in case of spasticity, It is Vata which is increased and Kapha which is decreased. Controlling power is decreased. Inhibitory neurotransmitters are decreased. Okay. Vata is increased or relatively increased. So what should be my treatment principles now? Either I have to go for Vata Shamaka and Kapha Vardaka treatment, because Vata is excess increased. Either I will go for Vata Shamaka treatment, or either I will go for Kapha Vardaka. If the inhibitor is increased, that is also okay. Then modulation of the brain neurotransmitter environment by different methods. I have to change the neurotransmitter environment, because in case of cerebral palsy now spasticity is there. The neurotransmitter environment inside the brain has been disturbed somewhere. Some way I have to correct it. Okay. Then I have to stimulation of the motor centers by the different methods. Stimulation of the motor centers by different methods. Then increasing the kapha is nothing but increasing the kama, or decreasing the vata is nothing but decreasing the raja. Okay, so now I have to make use of different major rasayanas. Okay, different major rasayanas which perform this function. I have got major rasayanas which are having vata vartaka properties. I have got major rasayanas which are having kapha vartaka properties. Now, if I talk of Shatavari, Shatavari is a Medya, Yashtimadu is a Medya, but it is Vata Shamaka. Whereas Vacha etc. is there, that is what that is Yashtimadu and Shatavari is there. Basically, they are Kapha Vardaka. Kapha Vardaka means they increase the neurotransmitters. Okay. So some of the neurotransmitter major drugs are like Vacha etc. is there. So they are actually increase the Vata, Lekhaniya and Vata. So they are increasing the Raja. So now I have got two set of symptoms. Now, two set of treatment with us. Another is, if this neurotransmitter regression is there or deficiency is there, if that is because of the atrophy, degeneration, etc., then I have to go for rasayana drugs. Then I have to go for certain rasayana drugs which increase the sarvadhatus. Enhancing the neuroplasticity. Now, neuroplasticity means, I think everybody knows. In the first 2 years of the life, the brain of the child is gone developing. During the development of the brain, and even to some extent thereafter also, if you give the continuous stimulation in the form of different sensory stimulations, you are able to create some new circuits in the brain. If the main road is blocked, you take the bypass road. So because of this continuous stimulation, what happens is the collaterals, that means collateral neuronal circuits will be developed. And this particular development is called as neuroplasticity. So we can try for that also. Otherwise, usually brain damage, neuronal damage once occur, it is unrepairable. But we can leave that road and we can create another road, another collateral road for that. So that is possible. So that is called as neuroplasticity. And by our methods, okay, by continuous bombarding the sensory stimulation, we can also create some of the neuroplasticity like condition. Now, establishment of the sattva state. This is important. I told Raja is increased, Tama is increased. Raja means excitatory, Tama means inhibitory. Now, in a normal person, what we require is there should be a balance between these two. Then the person is called as normal. Then your brain activity will be normal. Okay. So it should not be excess, it should not be less. Tama and Raja both should be present in a balance. So then the normal brain function will take place. When this normal brain function will take place, that state itself is called as sattva. That state itself is called as sattva. If the two neurotransmitters, they are performing normally, their amount is normal, and all the neural functions are normal, okay, psychological functions are normal, that particular balanced state itself is called as sattva. So we should try to establish this sattva state. Sattva state can be established, one is by balancing these two, and another one is by intake of the sattvika aharas. Okay, so if this balance is not possible now, you go on taking the sattvika ahara, that also increases the sattvika state. We will see that later. Then other treatment options in case of this is a treatment of the cause and also symptomatic treatment. So these are the different set of the treatment that we have to try in case of cerebral palsy, especially spastic cerebral palsy. So now, in the next class, we will see what are the different methods that we can follow in the treatment of spastic cerebral palsy. Thank you very much for watching it. And please don't forget to subscribe my channel, and also please give your valuable comments. We will meet in the next class. Thank you.